our program offers a really strong foundation for a career in psychiatry. Our residents actually rotate at two different tertiary hospitals. They rotate at Borges and Bronson. They also rotate at Battle Creek VA. They also work at Integrated Services of Kalamazoo, which is the community mental health center for Kalamazoo. So it basically exposes the residents to different settings and also like a wide patient pathology. In addition to all these clinical experiences, our residents also have a very strong didactic curriculum that is focused on foundations in DSM, psychopharmacology, and psychotherapy. We take about 6 to 7 residents per class, so we have about 22 to 24 residents at the most. So it's a small group. Our interns actually share a call like for about 4 or 5 hours with a PGY2 resident, so that's another great time to learn and at the same time like also know the senior resident. Some of our residents have also pointed out some other rotations like emergency psychiatry that's not usually offered in many psychiatry programs. We offer that experience for our residents here, so I think that's a highlight for our program. Some of the residents have told me about where the WMed grads have gone on for fellowships to like bigger and better places, I guess, but they have chosen to come back and be on faculty here. Here as a part of the medical school, you can actually communicate, you can be a part of M1 and M2 training in their preclinical years and not just in their clinical years as M3s and M4s, right? That's cool. We have a simulation center here, and I think you can be very creative about how you develop a curriculum or some didactics around a simulation center. We even have a simulation fellowship that's actually open to psychiatry residents. It also offers the opportunity to collaborate with other specialties, right? Recently we did a simulation for perinatal mental health, and we collaborated with internal medicine, med-peds, OBGYN and psychiatry residents, like all of them together. They had this perinatal mental health workshop, I should say, perhaps at the simulation center. So I think like such unique opportunities, I think, come from being a part of the medical school, and that is something to think about too. We also understand that these 4 years of residency training are a very crucial point in residents' lives, wherein several other personal things are happening for them. So like, you could be single and you could be looking for your significant other, or you could be with your significant other and planning for a wedding, or like all these very important aspects in one's personal life. So you need a lot of support, and our resident group is a very tight group and you will feel supported. So if anyone's looking for a program that offers a strong foundation in psychiatry and wants to feel supported, they should definitely consider us. Something that I have learned about Kalamazoo is it's a good town that offers you all the amenities and entertainment that any big city can offer. But at the same time, the cost of living is nothing compared to like any of those big cities, right? So I think that's definitely a big advantage. And like any other Michigander, I think people living in Kalamazoo will boast about the 4 seasons, and also Kalamazoo can boast about its proximity to the various activities you can do, like the proximity to the the Lake Michigan beaches, the proximity to the skiing areas, and I think the trails, like you can go for hiking here. So I think all of those opportunities I think are really helpful to enjoy the place. Just because of the geographic location of Kalamazoo, if you have family and friends anywhere in the Midwest, you can easily stay connected with them at any point. And I think family and friends and staying connected to them is very important. And I think Kalamazoo can help them with that for sure.